Hello, this is RJ Ashish from Fever FM, and you know what? Today with me is Dr. Sweta Agarwal, who is here for us to talk about infertility and the major causes of it. And this initiative is brought in by Gufic Biosciences Limited, supporting the national level infertility awareness campaign. Ma'am, thank you for coming to Fever 94.3 FM.
Thank you, Ashish. It's good to be here today.
Ma'am, about infertility, when we are talking, it's a topic that generally people don't discuss. You know, it is a topic that people want to hide and don't want to come to hospital. Let's start with that only.
Yeah, it is generally people. It's very personal thing, and not many people like to share about it. But the society now is changing. People are a bit more open than what they used to be earlier, and acceptability of any kind of fertility treatments is much more better than what it used to be in the past. Of course, it's a very personal thing which nobody wants to discuss, which is right.
This initiative is, brought in by Gufic. This initiative is brought in by Gufic Bioscience Limited, which is supporting a national level infertility awareness campaign, which is a very big thing. Coming to the most basic question, madam, what is infertility and is it a disease?
See, infertility is a condition when a young couple who is in the reproductive age group, who has been actively trying for a pregnancy, they are not using any kind of contraception, and for 12 months they have been actively having a try for a pregnancy, and if it is not happening, then we say that probably there could be an underlying cause of infertility, and they should approach a doctor for evaluation and further management if needed.
Okay, so it's not a disease.
It's not exactly a disease, but yes, they need to come forward if they don't get pregnant at the end of 12 years of regular unprotected sexual activity.
Okay. Ma'am, what is the percentage of occurrence of infertility in males and females?
Yeah, see, it's a disease of a couple. It's not a disease of a male or a female.
Right.
It's a couple thing, fertility. So 50% of the time, we find problems in the male partner. So when we evaluate a couple who comes to us with a difficulty in having a baby, so then when we do the test, we find 50% of the time there can be problems in the male, and 50% of the times there could be problems in the female partner. So both of them contribute equally.
Because there are common beliefs that only most of the time females have this problem.
No, that's not true. Thank you for putting across this question, because yes, people think that, and men usually don't come forward for consultations or evaluations. Of course, I have seen
the societal pressure
and the personal pressures are there. So I mean, I've been practicing this for the last 20 years. So times are changing. I see more number of men coming forward for evaluation and treatment. They have become more open about it. But yes, there used to be a myth that it's only for the female, but now people are understanding, and yes, it is both. When we want the couple to come first time for consultation, we encourage the husband also to come forward for consultation, for test, and they should support the wife whenever they go through these treatments if they need to. So she really needs the support of the husband when they are going through this treatment, because it's a couple thing and just not a single person, wife or husband thing.
Exactly. And what are the causes of infertility and can they be treated?
Yeah, so the underlying cause of infertility, when we talk about the female, it could be either problems with egg development. A very common condition in this is PCOD, polycystic ovarian disease, in which there is hormonal imbalance in the female partner. So although there are a lot of eggs in the ovaries, because of this hormonal imbalance in her body, there is no proper egg development or egg release. So anything to do with the egg development and egg release can interfere. Or the females have fallopian tube. So there can be blockade of the fallopian tubes because of any previous pelvic infections or any endometriosis or previous surgeries in the pelvic region. So because of that, there can be damage to the tubes and the tubes can become blocked. So then the fertility is affected. Or things related to the uterus itself, the womb. Okay, there could be some congenital problems in the womb, like septum, or that's like septum can be there in the uterus, those kind of things, or very large fibroids, or the fibroids which are encroaching the lining, the uterine cavity, the cavity of the womb, if it is encroached by the fibroids, or endometriosis. Any of these conditions can affect the chances of female get affected and is lowered for getting pregnant. And talking about the men, there could be problems with the sperm production, because of the hormonal imbalance at the pituitary or the hypothalamus gland level. If there is a hormonal imbalance which impacts the development of the sperm in the testis, the male organ, the testis, where the sperm production happens. So because of the hormonal imbalance, the production of the sperm can be affected, or because of some injury to the testis or infection to the testis or any reasons, the sperm production in the testis itself can be affected. Or if there is enough and good sperm production, there is a tube which brings the sperm outside, out of the body. So if there is any blockade in that particular tube because of injury or any infection or anything, the tube gets blocked. So even though there is a sperm production happening, it may not come out. So when we look at the couple together and do few tests, we get to know what could be the underlying cause of the infertility, and accordingly we can direct them to the different treatment options they have. So if we know the cause at the earliest evaluation we do, we can guide them to go for the right treatment to fast track their chances of getting pregnant.
Correct. That says it, because it is not a male or